So I'd like to discuss a subject that isn't always associated with osteopathic care, and that is post-operative care. An operation anywhere in your body can leave you with residual aches and pains, which many people just assume that they have to live with and accept for the rest of their life. And that's most generally not the case. And with correct osteopathic care, stretches, yoga, and nutrition, it's very, very possible that you can get complete resolution. So to discuss this subject, I'm going to use the example of one of my patients. This is Paul. Paul came to me with a shoulder pain. He had a restriction of movement and a lot of pain in his shoulder. He had a history of having fallen off a roof and caught him. So it looked like it was most likely a rotator cuff tear. So I referred him for a scan, and indeed there was a big rotator cuff tear. So he had his supraspinatus tendon reattached to the bone. The operation was a complete success, and we're very grateful for that. And the physiotherapist took him through a whole program of rehabilitation. So he regained complete mobility, complete power, complete strength, complete movement in that shoulder. 10 months later, he came to me with a lot of pain in his hand and his forearm and his upper arm, and just came to me to see if there was anything that we could maybe do to resolve it. Didn't directly connect it to his shoulder operation. So on examination, I found he had a huge amount of tension through the muscles of the upper arm and the forearm and the back of the arm, and also through the palm, just really high levels of tension. And any elevation in tension levels in muscles in the forearm, you can see here when I press on them, they do move the fingers. So there's a direct correlation between tension here and pain felt here. So the body is absolutely amazing. And when you have something like a rotator cuff tear and you have one muscle of the body that basically can't perform its function, all of the other muscles in the surrounding area will take over that job, and they will increase in their action and their firing. And the result of that, unfortunately, will be pain. But so these muscles here, all through here, all very high levels, just trying to compensate for a lack of function up here. Now, after you have an operation, very often these muscles that have been compensating for so long don't know that it's okay to relax. They don't know that the correction has happened. So you actually have to educate them and let them know. So we did a lot of deep tissue work through here, and we also did a lot of deep tissue work through the forearm and through the back of the arm. And you must remember that after an operation, while you're recovering from an operation, these muscles have to do so much work because the shoulder has to do absolutely nothing. So it's not even rocket science, it's kind of black and white that you're left with residual tension through these areas. So deep tissue work here, deep tissue work, and also a little bit of acupuncture. I did some dry needling through the forearm, dry needling into the hand, which is quite sore but incredibly effective at releasing chronically tight muscles. I also did a lot of stretching through the fingers, the hand and the forearm, and also through the pectoral muscles. I gave Paul some exercises as well to stretch out these muscles. And what else did we do? I think that's it. Gave him some yoga movements to open up the pecs and through the back. So we kind of treated it very holistically. And treatment did resolve Paul's pain, and the exercises did resolve his pain, but obviously those muscles are used to being held at a very high level of tension, so it does come back. So it's really kind of something that you have to manage. Pain can be managed, but once you've finished your osteopathic treatment and your rehabilitation, you have to maintain it. Unfortunately, it's just the way it is, because every day you're using those muscles, you're tightening them, and you must do the reverse to correct that. So so wherever your operation was, whatever part of your body you've had operated, just be aware that the surrounding musculature will adjust to compensate and support you through that process of correction. So it's completely normal to have to address an osteopath to help you get rid of that residual pain, which can be, in many cases, almost as bad as the pain you first presented with, these residual pains. So it's very unfortunate if you can't resolve them. But I'm telling you, you can. So do go and seek advice, seek the right care, and get under the care of an osteopath.